Hello everyone, greetings for the day. I'm Priyanjali from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infection or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal infection can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. Myfanwy Dsouza from Bangalore, to enlighten us on the topic of fungal infection. Dr. Myfanwy is a MD dermatology, venerology, and leprology MBBS dermatologist. Dr. Myfanwy is a dermatologist in Kankanadi, Bangalore, and has an experience of 9 years in this field. Doctor practices at UVA Skin and Hair Cosmetology Clinic in Kankanadi, Bangalore, and Practo Instant Hybrid Clinic 2 in JP Nagar, Bangalore. She completed her MD in dermatology and venerology and leprosy from Father Muller Medical College, Bangalore in 2018 and MBBS from Rajiv Gandhi University of Health Sciences in 2014. And today we have her here with us to enlighten us on the topic of fungal infection. So, without any further ado, doctor, let's dive into the first question, which is what is fungal infection in your language?
Yeah, in very simple terms. So, if we have to understand what fungal infection is, so basically, we've all heard of organisms like bacteria, viruses. After the COVID pandemic, everyone is familiar with the word virus. So we know that these are these small, like microscopic kind of elements. Okay, so a fungus is something similar to that, and it is something like a parasite. So it has a tendency to sit on the skin of a host. So it can either be human skin or animal skin. It can be present in the soil. So it's a microscopic organism which exists in nature, and typically, it is again it can affect the skin. So that is when it becomes a problem for us.
Right. Now, identifying any condition becomes a task for all of us. So, how
Correct.
do we identify the condition in the initial stage? What are
Correct.
the
So
early
now
symptoms, basically?
yeah, so this fungus, what we call it commonly, so there are different types, and right from your head to your toe, like any part of your body can be affected. So, if we're talking about the scalp, especially when we see in children where it is common, this fungus, it does tend to affect the scalp. So, especially in newborn babies, also we see there's a condition called cradle cap dermatitis. So there is like some of the fungal yeasts, they tend to sit on the scalp of babies and they cause flaking. So what parents will usually complain is there's a lot of flaking, there's a lot of dryness on my baby's scalp. So that could be one of the symptoms. And then as they age, then on the body, when the fungal infections can cause ringworm infections, typically what we'll see are these small very round looking rashes. They have a characteristic nature of that particular shape. It's called like a ring shape, hence the name is called as ringworm infection because of the shape. And so you will start feeling a little itchy. So itching is one of the main complaints, and the patients will definitely be able to see that the skin is not normal. There is some kind of redness, there is a round looking rash which is present anywhere. It can be from your face, on the body, on your hands, on the legs, on the private parts, anywhere. And then when it affects the nails also, so nails are another common site where these fungus tends to affect. You can see there'll be some changes in the color of the nails. So if you're noticing that your nail is looking white or is looking little dark or green or blue, some different color or some patches which are seen. Sometimes patients will say the nail has become very weak, like it's breaking off easily. So these could be some of the symptoms. Sometimes there can also be like a swelling around the nails and some amount of discharge. So these are some of the symptoms which are commonly associated with these fungal infections.
Right. Now, doctor, now that we know the early symptoms and how it looks in the initial stage, what can be the main cause behind it?
Yeah, so the way these fungal infections spread is mainly through
Mm,
contact. So, because see, some of them are present in the soil in nature. So, whenever there is prolonged contact with soil, the fungus tends to sit on the skin and it starts to grow there. Another way, this fungus, it also, we must remember that they love a very humid and a warm climate. So anywhere on your body where you're sweating a lot, which is very damp, say you work out a lot and you're sweating a lot, your armpits and your inner thighs, they're always like wet with the sweat, and you're living in an environment like where it's very humid. So this fungus, they like these warm and humid areas, and they tend to grow in such areas. So how they spread is, supposing there is someone in your family who has it, if you share their clothes, if you share their soaps, things like that, they can spread through those objects as well. Sometimes it's even people who have pets, especially. So these fungus, since it can even infect your pets, like your cats or your dogs. Sometimes when children are playing with the pets or something, they can even spread from animals to human beings. That is one way. And then again, people who are immunocompromised, who have a weak immunity, especially say those who are diabetic, or they're taking some sort of immunosuppressive drugs. There are certain medications which they have to take, because of which their immunities now become weak. What happens is, in them also there's a tendency for this fungus to grow, because now the immunity is suppressed, the body is not able to attack these outside infections. And so again, there is a chance that these fungal infections can occur in such people as well.
Right. Now, moving ahead, doctor, does different fungal infection in different area means different causes behind it, or the cause is almost the same?
Yeah. So broadly, if you're looking at the various types of fungus which infect the skin, there is something which is called as dermatophytes. Those are the ones which cause the ringworm. Okay. So those are one
Mm-hmm.
species. Now these can occur, they can infect right from your hair to anywhere on your skin, any part, and even it can infect the nails as well. And then there are certain other organisms which, they affect the deeper skin. There it is mainly because, like, if we have farmers and all who are working in agricultural fields, probably whenever they get a prick with some thorn or some wooden log or something, it enters the skin, there is some bleeding. There, the types of fungal infection is different. It's a little deeper, a little more serious. But the common one which we see, which is very common, a lot of people would suffer and struggle from, are the ones which are caused by your dermatophytes, or the one which causes the ringworm. So we'll talk about that more. So this ringworm infection is the one which can affect right from your head, your skin, your nails, anywhere. So it can affect any part of your body. These dermatophytes, yeah.
Right. Right. So, doctor, now, as you said that it is contagious, also there
Yes,
is a high risk of spreading it through your pets or people who are washing all the clothes together. I mean, the family people, anybody in
correct.
the family if suffering, if you use the personal items or, as you mentioned, washing clothes together, can be a reason of the spread. Can you please tell us what are the preventive measures one can take in a home surrounding in order to
Yeah.
stay away from it if somebody in the family is already suffering from fungal infection?
Yes, so prevention is actually one of the important aspects of treatment, which we always educate our patients, because most of them do come back saying that, it's coming back again and again. They don't understand what they're doing wrong. So the main thing is to tell the patients how the fungus spreads. So, like I already mentioned, it is through contact. If there is a family member who's having ringworm infection, if you're sleeping in the same bed, whether it's your husband or it's your child, your wife or anyone or your parents, you all are washing clothes together. So it's this fungus, it has a tendency to remain on objects like your clothes. It can even remain on the soap, it can remain on the towels that you use, and even the combs that you comb your hair with if you have a fungal infection in the scalp. So personal hygiene items, what we use routinely day to day at home, those are the ones which should not be shared. So we always tell our patients, please make sure that you are not sharing any of these items with your family members if you have an active infection. Not only that, even if you don't have an infection, it's always better not to share these personal items. And
Mm-hmm.
secondly, we tell them that, if there is someone in your family who has an active infection, please get it treated as soon as possible. Don't wait till it spreads everywhere, and then at a later stage they come where it becomes more difficult to treat. And then, like I said, a warm and a humid environment. Supposing, you're wearing damp clothes. Supposing it's the monsoon season, especially is where these fungal infections they tend to flare up during the summer and monsoon. What happens is in monsoons the clothes don't dry, and then patients they end up wearing the damp clothes, and that damp environment again causes the infection to start or to develop. Again, in summers, you're sweating so much, and then you end up you're not able to change your clothes into drier clothes. You wear the wet clothes for a long time. Again, there is a chance that the infection will worsen. So we always tell patients wear little looser cotton clothes, little breathable fabric, so that there is a chance of good ventilation and the skin remains dry. And then we always tell our patients that change out of if you're working out a lot, if you're a person who likes to work out, you go to the gym, make sure that you have a shower immediately after you come back. So don't remain in your
Mm.
gym wear for too long. So doing that, and especially gym wear, it's kind of like body hugging, it's kind of tight most of the time, and it's a synthetic material. So all those things, if worn for too long and if it's wet, again it's a problem. So we always tell our patients change into something dry immediately, take a shower, and that would be one thing. Another thing is during monsoons, especially, say, people they're walking in the rain and they've reached their workplace, and now the footwear is wet, the socks are wet. And the whole day, if they're sitting in those wet socks, no, it's again a problem. You can develop ringworm infection in the foot. So it's always better make sure that once you reach your workplace, carry an additional pair of shoes or something which are dry, and reach your office, change it. There are some powders which are available. You can always use that and change into drier clothes. I mean, drier shoes or socks. That is always a good thing. So never wear wet or damp clothes for too long. It's always bad for the skin. And apart from that, yeah, making sure that you have bath every day. So some patients skip, basic hygiene practices. So making sure that you have a shower every day also will definitely make sure that all these fungal infections are kept at bay.
Right. Basically, maintaining a proper hygiene is
Yes.
very much important. It's anyway important, but especially when we are talking about fungal infection, make sure that the hygiene is always kept in mind. Doctor, please tell us what are the treatment options which are available. Also, how do we diagnose a patient when the patient comes to us? What are the initial steps?
Yeah, so there are certain conditions which can mimic a ringworm infection or fungal infection.
Mm,
So in such cases, what we do is there is very simple bedside tests which can be done in, commonly it's done in any clinic or a lab. So the skin from the rash, wherever the rash is present, we just scrape a little bit of the skin and we take a look at it under the microscope. If the fungal infection is evident, we do see the filaments in the microscope. It helps us to confirm the infection. It's a very simple test. And as soon as, and apart from that, most of the times, the lesions, it is quite evident. The way the rash looks, it has a typical annular, what we call it, or the ring shape. So, although it's called
mm,
ringworm, it's not caused because of a worm. That's a misnomer. But the ring word is associated with it because you see, patients will say, "Ma'am, I have round patches on my inner thighs or on my body." So the typical shape of the lesion, which will be very itchy, and so that is the way it looks. Also helps us to diagnose. And of course, coming to the treatment, since it's caused by a fungus, we have to treat basically with antifungals. Now, whenever we have a viral fever, say if we have chicken pox, then we give antivirals. If we have a bacterial infection of the skin or something, we give antibiotics. Supposing you get an infection of
mm,
the throat or the nose, we give antibacterials, so or antibiotics. Whereas when it comes to the fungal infection or the ringworm infection, we have a particular group of medications which are referred to as the antifungals. So these
mm,
particularly target the fungus, and they are
mm,
available in the forms of shampoos, in the forms of creams, in the forms of lotion, as soaps, and even as oral tablets. So usually what
mm,
we do is we give a combination of all of these. It also depends on which body parts are involved. So supposing the hair is
mm,
involved, we will add an antifungal shampoo along with the lotion or the tablet. If it's on the body, we'll prefer something like a cream along with the tablet. And we'll also see how much of the body is affected. Supposing there's just one rash, on the face,
Mm,
maybe something like a coin shaped rash, probably it just needs an ointment or a cream. But then supposing it's like all over your body, it's in your underarms, it's in your groin, it's on the legs, it's spreading rapidly, we have to give oral tablets or the oral antifungals.
right. Now that we are talking about the antifungals, doctor, there are a lot of products available in the market, and probably most of the people they know the medications which they need to take in
Correct.
order if they are having such kind of symptoms. So we know the medications now, and somehow these medications they have stopped working for us at today's time. We see a lot of changes in the kind of medications which the doctors are, maybe they are giving a combination of medications. What is the reason, what can be the reason behind it, and how can self medication be harmful in the case of fungal infection?
Yeah. So the thing is, many I think households they are familiar with like Candid cream and certain brands which people it's become
Mm-hmm.
very popular nowadays. So the thing is, like your antibiotics, how they develop resistance. So resistance basically means that at one point of time you're taking a particular tablet for an infection, it was working, but over a period of time now this organism has learned to fight this tablet. It doesn't work anymore. So the same thing applies for the fungus also. Now, these off late, what we've seen is because of a lot of wrong medications and self medications, and when people self medicate, they don't know how long to take or when to end the course. They just take it for a few days, they stop, and they mix a lot of medication. So all of this is recently it has caused resistance. In the sense, what should be working is now not working anymore. So we need to come up with certain newer drugs or newer medications for the same infection. So self-medicating is always a problem, never advised. And especially because nowadays these antifungal creams are coming in combinations. So you don't have just the antifungal chemical in the cream. It is coming in combination, with a very dangerous, steroid. Steroids are good when, for certain indications we give it, but a lot of people are abusing it in case of fungal infections. There it becomes a very serious problem, because of which it's almost become like an epidemic in today's world. So the reason why the fungal infection has become so rampant is because people are using these creams which are mixed with the steroid creams. So that in fact worsens the ringworm infection, and it will even increase, and it becomes more difficult to treat. So it's always dangerous and never advisable to self medicate.
Right. Now, moving ahead, doctor, please tell us the main issue with fungal infection, which everyone is suffering with, is it has the tendency of reoccurring again. So, what is the main reason why it reoccurs, even if the person is under treatment, or he or she has stopped it for a couple of days or a couple of weeks? Why does it come back again and again?
Yeah, see, the reason that comes back is, see, whenever we treat our patients, we always tell them it's going to take a minimum of, say a month or at least 2 months to get complete cure. Most of the time,
Mm,
patients they start the treatment, and within 2 weeks they see that, oh, my itching is better and my rashes are also improving. Why do I need to continue the medications? That's the tendency
mm,
patients usually have. And in spite of telling them, still some of them they don't listen and they stop halfway. So they say, okay, I'm fine, I feel better. So why did the doctor give me so many tablets? And so what happens is those patients definitely it will come back because it's an incomplete treatment. So you may feel 60 to 70% better, but the infection is still not gone. So your doctor will be able to. We always tell our patients come back after the month. We'll examine your skin. We'll see how it looks, whether the infection is still there. Because the patients won't be able to make out, if although they may be feeling better, the symptoms of itching and all might have reduced. Even the rash may appear a little better, but we can make out if it's completely gone or not. And that usually takes a long time. It takes at least about a month and a half to 2 months. So we always
mm.
tell patients that to be compliant with the medication. So if they don't follow the instructions, that is a problem. And if they are using creams which have steroid in them, like combination creams, definitely they will have a recurrence. It's not going to go completely. Certain patients, what happens is because of the resistance, like I was saying, some antifungals, they're not working anymore in some cases. So when we initially treat them, they it may not go, and they may also have a recurrence. So that could be one more reason why they have a recurrence. Again, in case anyone in their house, like a family member, is suffering from the infection and they are not aware and they are sharing their items with them, again they will get the infection if they don't follow the basic, hygiene practices, whatever are advised about keeping
Mhm.
the clothes dry and those kind of things. Then again, definitely they will face a chance of of if it recurring again.
Right. So basically, it is a continuous process. We have to carry on doing that for the entire life. You have to understand that it has to be a part of your regular routine. Now,
Correct.
moving ahead, doctor, please tell us, can oral medications be can it be safe to use during pregnancy?
Yeah, so most of these oral medications in pregnancy, again, we always are extra careful, especially in the first trimester. So the first 3 months is, where the baby's organs are forming, a lot of development is happening. So during that stage, preferably we do avoid giving oral antifungals. But the thing in pregnancy is that, see, in pregnancy, because of the hormones, the woman, she will be sweating a lot. So because of that, again, she's more prone to develop these infections. So pregnant women are always at a higher risk to develop the ringworm infections in the first place, especially during the summer seasons because of the profuse sweating and the hormonal changes. Definitely, they'll have the chance of getting ringworm infection. So we'll wait probably say till the fifth or the sixth month. That would be a more safer period to start the patient on oral antifungals. Not all antifungals are safe in pregnancy, but there are a couple of so all the creams, most of the creams are safe. Okay, most of the creams are safe, probably except a couple of them. But so there's no problem by giving creams to apply or lotions to apply or soaps also can be used. But when it comes to choosing oral antifungal tablets, we'll probably wait till the seventh or the eighth month to start them. And there are a few tablets which are safe, which can be given, which
Mm.
don't carry any risk of, abortions or miscarriages or any malformations in the baby. They can be safely given.
Right.
Again, with close
And
monitoring with the doctor, making sure
right.
that the patient is following up. Yeah.
Right, definitely, definitely. Please, people who are going for self-medication, we have already talked about it once, that please do not go for self-medication, or do not ask your neighbor or your parents that what medications they have used. Make sure that everybody has a different body, you have a different uh, uh, immunity, so you are a different person altogether. So,
Yes.
visiting the dermatologist or visiting a doctor individually is very much important. You yourself need to get treated. You cannot just use someone else's treatment and use it on your own. That's not how it works. Now, moving
Absolutely.
ahead, doctor, is it safe to use these antifungals for a long time?
Yeah, so whenever we give these oral antifungals, usually the common duration for which we give them would range anywhere from 2 weeks to 6 weeks minimum. Okay, for especially
Mm.
in patients where it's very severe, like almost say 75% of their body is infected by the infection, they will require a long period of treatment. No, it's not going to go away in 2 weeks, it's not going to go away in 1 month. So in such cases, probably they may need to take it for about 3 to 4 months or so. So most of them it may settle down by 2 months, maximum 6 to 8 weeks. Sometimes it does take a little longer. So in those cases, what we do is we routinely keep doing certain blood tests. So we especially we do their liver profile, we do their kidney profile just to see if the tablets are not doing any harm. So with the regular and the routine monitoring of the blood tests, we can continue these tablets. It's safe to continue. If there is any derangement, then we probably will think of an alternative. Or else it is okay to continue. Again, you should be carefully monitored by your treating doctor. You can't self medicate on your own for 6 months to 1 year. That would be not advisable. That would be risky. Yeah.
Right. Doctor, I can see a few questions coming up from the viewers. The first question comes from Kiara, who asks, is black fungus rare?
Yeah. So we are talking about mainly the infections or the fungus which is infecting the skin. Now during the COVID time, that is when we started hearing of this black fungus again. That is more of
Mm,
a deeper fungal infection, which affects your sinuses, your inside your nose and other
mm,
areas associated with a lot of fever, with headaches, headaches. It's more of a systemic infection. It is very serious. Should be diagnosed
mm,
early and treated. So that is a
mm.
different case altogether. So very it's rare. It is rare. It's not as common as your ringworm infection.
Right. How does it look like in the initial stage? And is it also contagious?
Yeah, so patients usually they will be able to see certain sort of they'll have some changes in the smell or altered smell, or they can make out that there is some amount of black color tissue which is growing inside the nose or even inside the mouth. Those kind of things. They can start having fever. They can have headache and
Mm,
related symptoms. So those are the ways in which you can identify. So taking a proper swab and doing a proper examination of the nose and the throat, it will help you to rule it out.
right. And when can we get to see it? Is it when we are prolonging the condition for a long time, or there is any other reason behind it?
Yeah, again, your immunity plays a role, especially if your immunity is very much compromised. In that case,
Mm-hmm.
those are the cases where we do see this black fungus occurring. So yes, we always have to be very careful in those who are whose immunity is very much compromised, especially diabetics who's out of control, or patients who are
Mm,
on medications on immunosuppressants where they've been taking it for a long time, higher doses. If they are complaining of these symptoms, we have to be on high alert in such patients.
right. Well, doctor, the next question comes from Pinky, who asks, is white fungus spreadable from person to person?
White fungus, I think, is she referring to the one like on the nails or on the skin? So usually what happens is, uh, see, on the nails, you can get these fungal infections where you will see white kind of patches, okay, on your nails, and then
Mm,
again you can have a fungal infection on the scalp also, like which is seen in the form of your dandruff, okay, which is again it is your dead skin, but along with that it is the fungus or a yeast which is causing it. So those
mm,
conditions they do have a tendency to they can spread.
right. The next question comes from Tina, who asks, how did black fungus start?
It is caused by an organism, like your mucormycosis is the name. So it is a fungus which does exist in nature, and then again it is very rarely seen because only in severely immuno suppressed patients we this kind of gets activated.
Right. The next question, doctor, comes from Lucky, who asks, can black fungus spread from one body part to another?
Yeah, see, since it's a systemic infection, okay, it can spread through your bloodstream, through your sinuses. It can enter the brain also. It can enter other body parts also. It can spread.
Right. The next question is comes from Kiran, who asks, can turmeric cure fungal infection?
Not advisable. Again, turmeric is not for that. So people do have a chance of, I mean, they do want to try, home medications and things like that.
Mm,
But again, turmeric is not in literature. We do not find any, such sources which support applying turmeric. There are very good antifungal creams and lotions and products available which can cure the fungus very well. People have
mm,
they do like to apply turmeric even for like a wound or something like that. It has more of an antibacterial property. Antifungal as much I wouldn't say. Wouldn't recommend it.
The next question comes from Sonal, who asks, can I use soap on fungal infections?
So sorry about the camera.
No, it's absolutely fine. We can see you.
Yeah. Tell me, ma'am. Can you repeat the question again?
Can I use soap on fungal infections?
Yeah, you can use soap. So sometimes what happens is, if the patient has severe infection, we do recommend certain antifungal soaps. Okay, which again we don't use recommend these soaps to be used for too long. So probably as long as you're having the active infection, you can keep using it. See, as the people do have certain organisms which do stay on the body, like certain fungus. They don't harm your body, but they live there
Mm,
normally for everybody. So if you use these
mm,
soaps for too long, even the normal existing organisms also die, which is bad. We don't want that. So as long as you're having the infection, it's okay to use soaps. We do recommend using antifungal soaps. Even normal soaps also should be used whenever you're taking a bath. You can use your regular soap if you're having a fungal infection to take a bath and to clean yourself. It is advisable.
right. Doctor, what about skincare? I mean, there are a lot of products firstly available in market. People are using it widely. What if the
Yes.
person is already suffering from fungal infection on the face, and he or she is using all those skincare? There are steps of skincare which people follow, starting from
Right.
eye cream to a lot vitamin C, niacinamide, retinoid. Everybody is widely using it because, of course, it
It,
works. And
yeah.
the moment they get to see such changes on the skin, it tends to become a habit. So, what if the
Yeah.
person is used to using a proper skincare regime? Is it safe for the person to use such products?
Yeah, see, certain creams may have, like, especially the skin brightening creams. Nowadays, people like to use a lot of these creams which say skin shine, skin bright, and all those things. They may have
Mm,
steroids in them. Okay, so they may have steroids. And if you already have a existing, like a ringworm or a fungal infection on your face, definitely it has to be stopped. Otherwise, the fungal infection is going to be, it is going to spread. So if it's something like a moisturizer or your sunscreen, those kind of things are fine to continue. But other products, I think would it would be recommended to stop them just for a brief period of time till the fungal infection is treated and it is cured. Because it is curable, it is treatable with the correct treatment options. And once you're rid of that infection on the face, you can always resume your routine day care, your skincare practices. So you can continue the face wash, you can continue moisturizer, probably some night serums are there. All those things can be continued, but during an active infection, we'll always try to minimize the products. Keep it as minimum as possible. Use the medicated products on priority. And once the infection is clear, you can resume your entire range of your skincare products.
hmm. What about sunscreen, doctor? We know that it is very much important for us to apply sunscreen. So that also needs to be medicated, or we can use the product which we normally use.
When it comes to ringworm infection, it's fine. All the sunscreen is doing is just protecting you from the sun, from this UV rays from the sun. So it doesn't
Hmm.
matter. You can use your sunscreen along with it. That's okay. It's just going to sit there on top of your face, so it's fine. No
Right.
issues.
Right, right. Also, doctor, tell us, because immunity also plays a very important role here. You mentioned.
Yeah,
Tell us about the fungal infection which happens, which takes place in the groin area, becomes very painful for both the gender. Also, it is somehow difficult for the people who are working uh, to have a proper place to urinate. They
correct.
somehow needs to use the public toilet, which
Yes.
everybody is using. So
Yeah.
can that be one of the reason for the spread? If so, what are the preventive measures one can take in?
Yeah, so the fungal infection which affects the private area or the groin area, again, it's very common. That is one of the reasons is again is because you're wearing your underwear, your trousers may be tight, okay, your innerwear also may be tight, and because of the moisture in that area, because we use the
Hmm.
washroom and then we wash it, and if we continue to wear a damp innerwear, so definitely there's a chance that it will grow, the fungus will grow, and it's usually associated with a lot of discomfort. So patients, many times patients are shy to come and even tell us that they have something there, because it's, it's a private part, and they delay the treatment. They probably come,
Hmm.
after it becomes worse. So one thing we tell our patients is make sure that you're wearing loose, innerwear. Don't wear something which is too tight. Always wear cotton inner garments, and try to wear little looser trousers like tight jeans or leggings, those kind of things. Again, we tell them to avoid wearing, so that that area is kept a little more ventilated. And again, we do tell them to take treatment for it. And yeah, those are the things. It does affect, even married couples, it does affect their intimacy also because of this
Hmm.
infection. So we do tell them to take prompt, treatment for the groin area, especially. That is one of the
Hmm.
common areas which is affected by the ringworm infection, actually. So
Right,
wearing
right.
newer clothes, drier innerwear, very important.
Mm-hmm. Uh, Now, if you're talking about dryer innerwear, I mean, it can be a little tough for the men, but for the women, the area normally tends to be moist.
Yeah.
Also, people who are working all the time, it becomes very difficult for them to, always dry the area. Again, doctor, any prevention for that?
See, we can, one thing we can do is, if you're working very for long hours, sitting for long hours, you're unable to come home and, change. We tell our patients, if possible, always carry an extra pair of innerwear if it gets too damp. That is one thing you can probably change whenever you have a break at work. There are
Mm-hmm.
certain dusting powders available. So the same
Mm-hmm.
antifungal powders are there. So these can be applied over areas, the private areas, so that the moisture is a little bit of control. And
Mm-hmm.
we always advise them, you carry a toilet paper roll with you wherever you go, so that make sure
Right.
that after every wash you dry the area, and make sure
Mm.
that the innerwear is dry. So some basic, at least these measures, if they can follow, you can control the infection to some extent.
Right. Also, is there a tendency of reoccurrence for this kind of fungal infection as well?
Yeah, yeah, there is definitely a chance. Again, if it's not treated, 100%, only if it's treated, say 50% or 60%, again, it will come back. Again, it depends on
Mm.
the climate, because of if the environment in which the patient is. Supposing, they're in a very humid environment, it can definitely it can come back. If they don't take personal hygiene measures, there is a chance that it can recur again.
Right. And what about the immunity? Does our immunity also plays a very important role here? If yes, um, how can we boost our immunity? Any diet,
Yeah.
any lifestyle changes?
Yes, immunity definitely, because what we see is those who are diabetic, especially those patients, they are at a risk of developing these fungal infections. Whenever their sugars are out of control, then we see that,
Mm.
the fungal infection also accordingly it flares up. It tends to spread or becomes more. So there is a relationship, and there are a lot of people who say cancer patients or those who have got some transplant, organ transplant, they are put on certain immunosuppressant drugs, or those who have arthritis and all that. Most of the time, they usually are put on some sort of an immunosuppressant drug. Commonly, patients who are taking these steroid medications, like oral steroids,
Mm.
for different conditions, maybe for your asthma or for your joint pains or whatever it could be. These patients also, over a period of time, their immunity will also fall because of this steroid tablets and other tablets. In them also, again, this fungal infection is very common and it's very hard to treat. So for such patients, again, eating a good diet and taking certain multivitamins, some tablets to boost the immunity, it helps to some extent.
Right. Well, we had a wonderful discussion on the topic and we got to learn a lot from you, Doctor, today. Uh, Before we take a leave, any take home message for our viewers who has watched us so far?
Yeah, so always remember, never delay treating your fungal infection. Even if you see the smallest of patch on your body or you have a doubt, please visit your dermatologist. Never run to the nearest drugstore near you and get some sort of cream to apply. It's always better to consult your doctor, get the condition evaluated, and get it treated. Follow very simple, basic hygiene practices, whatever I mentioned, and you can keep these fungal infections at bay. Yeah,
Well, that was expert advice for today, and that was Doctor for us. Thank you so much, Doctor, for your valuable time. It was
thank you
quite an
so much.
informative session for our viewers today, and we look forward to many more such sessions in coming times. Also, thank you, viewers, for your excellent participation. For more information and updates, stay connected on our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you.